wabiro kelonu achiel kachiel chenro mar kama bende jatend migao mar arita Kithure Kindiki kod nitiere nyim komiti mar od bura ewi thoe Mashaka Ola. Kao kamano wadhi nyime koda weche matimore. Yuaruok ewi chido mag jochiw thieth kokalo chenro mar thieth mar UHC ochope komiti senate mar thieth kama oyang ni kuom jochiw thieth go maromo 800,100 emanie lwet maromo 800,100 emanie lwet piny owacho mamalo. Jochiw thieth gi nomedo ni orak mar tich mar higni 3 kapok oyang yore malong'o mag chulogi ka yuaruok nitiere kinde duol mayango sach jotije piny owacho SRC kod duol mandiko jotije sirkal PSC.
By the Ministry of Health for extension of the contracts of 8,571 UHC health workers is due for consideration. So my question is, I've had Public Service Commission saying that they have extended for 1 year. Yet in their submission, they are saying they are still in consultation. And yet they are also saying in June 2023, of course, the terms of UHC was supposed to lapse. So what is the position of Public Service Commission in regard? Are you extending for 1 year, for 3 years? Are you, because of also natural attrition, are you putting also an advert to replace either those people who have either resigned or gone anywhere else?
We only facilitated the recruitment for the project chair. So the extension was the request was brought to the attention of the Commission by the CS Ministry of Health, requesting that we renew for another 3 years. But we are privy to the fact that UHC workers were supposed to be absorbed into the regular establishment after the 3-year project has ended, and there is need for these workers to continue delivering service to in the health facilities. And therefore, we declined the request for renewal for 3 years. That was what the request from the Ministry of Health was. And extended it for 1 year so that in the meantime, in the 1 year, the UHC workers are not out of job. They can still continue working under the same terms as they are working now, but to facilitate engagement between the county public service boards and the Ministry of Health to allow for the UHC workers to be absorbed into the regular establishment.